Hi, I'm Dr. Raman Sakhuja and a consultant psychiatrist and a professor of psychiatry. And I'm practicing in Cardiff. I make videos about mental and emotional disorders, and through these videos, I'm trying to share some easy tips that you can implement in your daily life to improve your overall wellness. Additionally, I also share information about the medical treatments available right here in Cardiff for all of these concerns. So today's video is on bipolar disorder. So what is bipolar disorder? By definition, there are two poles to this. So the pole of someone feeling manic, experiencing hypomania or mania, and the other pole where they feel depressed and experience the symptoms of depression. In general population, in adults, it is about 1% of patients or people in the general population may have bipolar disorder type 1, and the other, which is called the bipolar 2, that prevalence is around 2% in the general population. So what is bipolar 1 and what is bipolar 2? Now, bipolar 1 typically is the disorder where there are the poles of someone having mania and depression, whereas bipolar 2 is someone having hypomania and depression. Hypomania is a much lower and less severe form of mania, and that is why it's called bipolar 2. So looking at the bipolar disorder as such, what happens in mania, hypomania, or depression? Let's look at those. So the typical symptoms that someone who has a manic phase will be, simply put, an increase in the overall mental and physical activity. By that, what it means is they may experience high energy, impulsivity, distractibility. Their mood gets high. They feel elated, happy for no reason, and they stay up in that phase for days together. They may feel that they don't need any sleep. They may take on activities which are far more than that what they are capable of attending. And they may have an increased over talkativeness. They may find it that their sex drive goes up. They may be disinhibited. They may be taking on riskier things. So all of those things comprise mania. Slightly lesser version of that is hypomania. In manic phases also, some people may have a much more severe form where they may start having some psychotic symptoms. And on the contrast, if we look at the depression side of things, again, if mania is increased in the physical and mental activity, in depression, it is quite the reverse, where there's slowed up mental and physical activity. So concentration problems, mood dipping down, difficulties in decision making, concentrating, sleep also can get disturbed. They have poor motivation to do things or engage with day-to-day life. So all of these are those two poles of what is seen typically in a bipolar disorder. One of the key things in bipolar disorders is that the mood symptoms that people experience is something that lasts for a few days altogether, as opposed to someone who's having these fluctuations within the same day. And if they are having it within the same day, that may point to the picture of them having something different and not typically a bipolar disorder. Because as I said, in bipolar disorder, the symptom state lasts for a few days together for us to say this is bipolar disorder. So when we think about the causes and the risk factors of this condition, genetics plays a huge role in this. So without going into the technicalities of twin studies and all, which I can talk about at another video, but what we know is that there's a strong genetic component in bipolar disorder. So about 40 to 70% times in the twin studies, we found that people can have that component, which actually translates that about the first degree relatives that people may have is about 5 to 10% increased risk that people may get in their first degree relatives. And that equates to almost 7 times higher risk that someone may have within the family as compared to the general population. So genetics does play a very important part. and therefore the family history, and equally the debate of nature versus nurture gets alive over here, in that the way an individual's upbringing is, their family dynamics, traumatic experiences, all of those can influence the development of a mood disorder such as the bipolar disorder. Now, when we start thinking about diagnosing and treating it, it involves quite a detailed, comprehensive history. We tend to often use mood charts. We tend to use history and gathering information from the patient, as well as collateral history from other people such as their families and friends, to see what their level of functioning is like when they are experiencing those symptoms. And all of these put together then make us closer to a diagnosis of a bipolar disorder. It is very, very important that this is detected as early as possible, because it has a bimodal distribution. By that I mean that mostly it is the young onset. That means people at their early 20s, and to be more specific, between 15 and 25 is the age of onset. And then sometimes we see a second mode of presentation, that is between 45 and 55 years of age, the onset of this disorder can also happen. So the earlier we find it, detect it, assess and start treatment, the better the quality of life and the symptom control. The treatments for this by and large involve medication, psychological intervention, and lifestyle changes. So medications, the mainstay of medications are mood stabilizers. And by mood stabilizers, what that means is that these are medications that help in reducing the peaks of the moods that people are getting, so that the mood are more stable than otherwise. Along with that, obviously, there is an important role of psychological therapies, and knowing what are the things that trigger off the relapses of these conditions, making lifestyle changes, and understanding those trigger points and managing them early on can really help in managing this condition better than not. And if you like this video, I would encourage you to like, subscribe, comment, share, and please don't forget to press that bell icon so that you get all the notifications for all the upcoming videos from this channel.